Hi, welcome back to my live show. This month, I'm doing a series on holistic approaches in cancer care, both for cancer prevention as well as for cancer survivors. Um, for those of you who are watching it live, please type hashtag live in the comments. For those of you who are watching later on the replay, please type hashtag replay in the comments. Today, I'm going to talk about dairy and cancer. Now, dairy is a group of food where there's a lot of confusion and controversy surrounding whether it's good or not good. First, I want to take time to explain something about dairy. Now, we say dairy, but we group a number of foods under this uh, heading. So, they could be dairy can refer to milk, which can be from cow, sheep, or goat. It also refers to fermented products like cheese, yogurt, or buttermilk, or kefir. And it also refers to different types of milk like lactose free milk or A2 milk. And it could also refer to predominantly fatty dairy products like cream cheese, cream, or butter and ghee. So when there's a lot of these different types of foods grouped under one heading, that's why there's a lot of controversy on whether it's good or not. Now, dairy is a good source of protein. Specifically, cow's milk is a good source of protein, calcium, as well as vitamin D. But there is a lot of concern also about dairy because cow's milk is considered an allergen that triggers inflammation. There is also, contamination with antibiotic and hormones, and these are minimized. We overcome a lot of this by using organic dairy products, which eliminates the antibiotics and growth hormones. Still, experts believe that there may be some hormones in the milk, despite consuming organic milk or E2 milk, that can give rise to inflammation. Now, when we look at dairy and cancer risk, the studies are not very conclusive for the same reason I talked about, because there's so many different dairy products, and uh, it's very hard to put together information from different studies, and people don't consume just one dairy product, so it's hard to get results out of that. Um, but what we do know is dairy has been known to increase the risk of prostate cancer. So if you're, someone with a high family history, if you know, if you're someone with a family history of prostate cancer, or someone who's diagnosed with prostate cancer, or a loved one or friend has been diagnosed with prostate cancer or has a family history, then it's prudent to avoid dairy products in such a situation. With respect to dairy and breast cancer, we know that dairy products increase the level of a substance called insulin like growth factor, or IGF-1, in the body. And we know that IGF-1 is associated with breast cancer risk. So it's possible that dairy may increase our risk of breast cancer. Once again, so far the studies are inconclusive, but this is one thing that the experts feel. Um, Fermented dairy products like yogurt, buttermilk, or kefir are protective. They are protective against inflammation. They are beneficial to the gut microbiome, which in turn indirectly help reduce the inflammation. And they are also protective against cancer. So fermented dairy products are good to consume. Um, Even among the dairy products, the high fat, the full fat dairy is considered to be more of a risk factor for cancer than low fat dairy. Again, studies are not conclusive, but this is what the experts believe. And also, I want to distinguish one more thing amongst the dairy products. Some products like milk and cheese contain more proteins, and hence, they are the better products. Some other products like butter, um, cream, and cream cheese contain fats more predominantly and are more considered more inflammatory. So it's also important to recognize that distinction. If you or someone you know is looking for a holistic approach to cancer prevention, or if you or someone you know is a cancer survivor and is looking to add holistic treatments to their cancer care, go to www.ayur.today and schedule a discovery call with me. Once again, I am Dr. Malti Acharya from Ayur Integrative Medicine, and it was wonderful talking to you today.